Picture this, you in the US and you might wait hours in the emergency room just to see a doctor. In Korea, you're in and out with world-class treatment, maybe even grabbing a prescription on your way home, all without burning a hole in your pocket. Sounds too good to be true? Today, we're gonna dive into reasons why Korea's healthcare system is probably the best in the world. Hello everybody, my name is Ade.
Yo, this is David.
This is S-Korea 360, your #1 source for everything Korea. Top 3 reasons why Korean healthcare system is probably the best in the world. David, do you know a lot about the Korean healthcare system?
Yeah, you know I do.
I think you know a little bit too much about the Korean healthcare system. There's a lot of good and great. So let's jump into what's number 1.
Number 1 is universal healthcare coverage, expansive and inclusive. And you also talk about cost-effective treatment. But let's talk about the coverage itself.
Sure.
So in Korea, when you're living in Korea, working full-time jobs, I think even part-time jobs too, it depends on what the company is offering. They give you an option to get coverage from the national health insurance. So
Sure.
the Korean government provides you with the basic necessities for healthcare.
Right.
That includes you visiting the hospital, whereas some people will pay $50, you only pay $10, for example.
Right.
So national health insurance is really nice here in South Korea.
Right.
Because it covers the basic things, but at the same time, it's not just the basic things, it's a lot of the things that that includes like dental,
Right.
eye care,
Right.
bunch of other stuff.
Right. One thing that's wonderful about the Korean healthcare system, everybody has to have it. So even as a foreigner, when I came in Korea, my school had to provide it.
Yeah.
Now I heard you can't use it or use it extensively up to 6 months because they don't want people just coming here and doing getting their work visa and then doing like medical tourism.
Sure.
So I think you have to wait 6 months, but after that 6 months, you're free to use it and you are pretty much the same as any other person, Korean nationality person in Korea. So that's one thing I really liked about it. They don't really discriminate. Once you're on the program, you're on it. And you talked about the comprehensive coverage.
Right.
Like, I've been in Korea for over 10 years, and I'm still surprised at what the healthcare system is covering.
Right.
And talking about comprehensive coverage, like we're Canadians, right? And we think we have good healthcare. Any Canadian knows, living in Canada, you know your healthcare system, our healthcare system is not as good as people think it is.
The thing is, when you're living in Canada, not having traveled abroad to South Korea, for example, you think that Canadian healthcare is good because you can only compare yourselves with Americans.
Right.
whose healthcare
Americans
system
think Canadian is amazing.
Yeah, whose healthcare system is pretty bad.
Right.
But then once you've come to Korea and you've experienced how good the basic coverage of Korean healthcare system is,
amazing.
You'll start to regret your words because the Canadian healthcare is pretty bad.
It is. In Canada, because we're both Canadian, in Canada, like I went home a few years ago and went into a walk-in clinic. And I still had my Korea brain, thinking that I was gonna see a doctor quickly.
Yeah.
So I walked in, huge line. They're like, oh, it's gonna be a couple hours, or maybe a long time.
Yeah.
I had time, I went, grabbed lunch, came back. She's like, no, more time. Went to the grocery store around the corner, did my shopping, came back, no, more. And then I put on a whole Netflix movie, watched the whole movie, still ended up waiting to see a doctor. And when I saw the doctor, you only see him or her for like 5 minutes.
Yeah.
Right? And that was free, that was wonderful. But then the prescription, had to wait an extra hour for it, and it cost me $40 for something like super simple. Where in Korea, you can do all of that on your lunch break and still have time to go eat lunch.
Yeah.
Right. So David, when you go to the hospital in Korea, can you tell me what a typical visit is like?
Yeah, I mean, I go there pretty much every day now.
Okay.
So, going in.
But let's say you're like sick, you got a cold or a natural, just regular ailment, and you went to the hospital. What would it be like?
So you go in cold. You don't book an appointment when you have cold.
So no appointment.
You literally walk in. These are walk-in clinics. I mean, they're not called walk-in clinics in Korea, but they're basically walk-in clinics. You walk in, the receptionist will greet you. You say hi, you go over to the receptionist. They ask you for your name in your alien number or your 주민번호. And you tell them the number, and they ask you to sit down. And literally, the longest I've waited was 15 minutes. That was because there were 20 people in the room.
Yeah, and it's long. 15 minutes is long.
Usually when you walk into these clinics, at most you'll see 3 or 4 people there. And you'll get called up in 5 to 10 minutes.
Right.
You don't have time to sit down and watch Netflix because they'll just call you. So as soon as you start watching something, they'll be like, your name, and you come up, the doctor will see you, and then you just walk in, talk to the doctor, and you tell them what you need and what you have. They'll diagnose you in 5-10 minutes. You walk out, you pay your fee, and then you go to the pharmacy. Pharmacy is always busy. There's always someone getting medicine, but that doesn't mean you're gonna be waiting an hour.
Right.
It'll take like 5 minutes, 10 minutes max. So your whole trip to the walk-in clinic, you probably walked longer than the amount of time you stayed in the clinic. So it's really convenient, really fast. Yeah, so that's my experience with the walk-in clinics here in South Korea. Really quick,
Right.
To the point, and you get your meds, you know, get well soon.
Right. So I want to talk about one time where I wanted to see a dentist. Okay. And living in Canada, I was on my mom's government insurance or whatever, but I guess she wanted to come off it, or at a certain age I had to come off. So I came off at 15. So I've never seen a dentist since I was 15 until I came to Korea.
Wow.
Right? And seems kind of crazy, but in Canada it's kind of natural because seeing a dentist is expensive.
It is.
It's very expensive.
I
And we didn't have the money.
15 years ago, when I got my scaling done, $500.
Whoa, okay.
And that was covered by my dad's company.
And you still had to pay more. Oh, that's what the
like
the
$500
insurance covered it,
per
right?
family member. So it came out to $1,500 because me, my mom, and my dad got it. So expensive, right? I never thought scaling was that well, scaling plus other things we did, but it was like a yearly annual checkup thing. So that's really expensive.
Right.
So, sorry to interrupt.
No, it's okay. And then I never went to dentist probably like in 10 years.
Yeah.
And I didn't know I had dentist like coverage because to me that's like for rich people, right? And my friend's like, no, you have it. Everyone has it, right?
Yeah.
So I book an appointment and I go. They spoke English. And how long is scaling? Like 10 minutes, 15 minutes?
Yeah, 10, 15 minutes max.
Yo, it was like 45-minute battleground. She was sweating. I was sweating. The aircon was blasting.
This is a boss level.
Yo. Now, no cavities. I've never had a cavity in my life.
Probably plaque.
No, it's just, like normal, whatever, right? But she's like, you gotta just brush more. She's like, when's the last time you did the scaling? I'm like, I don't even remember.
Yeah.
Right? But ever since then, it's only been like 10, 15 minutes for the scaling.
Okay.
But I felt like, I don't know, like it was such a weird feeling going into a dentist. And I was worried about how much I had to pay. I remember it was like $9 for the scaling. This was years ago, right? Every year it goes up by like $1.
Yeah.
And I just felt like, wow, this is how it feels to actually, kind of be human.
Right.
You know what I mean?
For all the expats also tuning in, scaling is covered by the national health insurance that your school
and you
or
get
your
one.
hagwon pays for, right? Well, actually, you pay half and the hagwon pays half. That's what it is, the 50% thing. If you look at the pay stub, it's also once a year, so you can get pretty much free dental checkup once a year. That's covered by the hospital.
Right.
Yeah.
And yeah, it was just a wonderful feeling. Now I go to the dentist. Like I was on the way to the last time I went to the dentist, I was going to the gym and I'm like, oh shoot, I gotta go to the dentist.
Yeah.
And I just popped into the dentist.
Nice.
Before I went to the gym because it took like literally 20 minutes.
Right.
Literally in and out in like
And
20,
it's
25 minutes.
usually walk-in for the dental clinics too.
Right. They try to book appointment, but you can just whatever. But you can just walk in and then they know who you are and then like, oh, you ready now? Right now? Sure. You go in, X-ray, scaling, brush your teeth, and then you get out of there.
Yeah, and one thing I also noticed about the dental clinics, I went there recently as well for my annual checkup for the scaling thing. They have a bunch of equipment that I've never seen before. And they're like new, like they're like really cool too. And I'm 6'4". I'm tall for a Korean, right? And they have these X-ray scaling or X-ray thing for the teeth and stuff. And usually, all the machines that I go to, they're usually kind of small for me, so I have to bend my knees or whatever. But this one went all the way up to my height.
Oh, crazy.
And the nurse had to step on a little stool to to see my teeth and all that stuff. So I'm like, so they have really like high tech, you know, up to date systems for tall people even.
Right.
So I was really surprised.
They had some machines I've never seen before. Like they had one machine where I had to go in and like bite down on something.
That's the thing I'm talking
Yeah,
about.
right.
Yeah.
And then the machine spun around.
Yeah, yeah,
I
yeah.
thought I was gonna get teleported.
Yeah.
I've never seen that
Back
one
to
before.
the Future, right?
Yeah,
Yeah.
right. And finished. I'm like, what'd you do? They're like, oh, it's an X-ray. I'm like, oh, that's what it was.
Yeah.
And then they sit you down and then they show you your X-ray
Your
right
teeth
there.
and stuff. Yeah,
right there. So you can
It shows you all the roots and everything. It was pretty
everything,
cool, yeah.
right? So, yo, man, like honestly, I just feel, I don't know what, I feel appreciated. I just feel some kind of satisfaction. Because I can never do this back home. And I've worked back home, like lived back home, I can never do it.
Exactly.
As a matter of fact, quick story. I remember I was in university and some of my gums that grew over my teeth. And I was a university student working, struggling, right? And I couldn't eat anything for like 2 weeks, drinking soup. And I didn't have dental. Now I knew I could see a doctor. I went to a doctor, waited like long, whatever.
Yeah.
See the doctor for my teeth, and he's like, "You gotta see a dentist." Like you know you gotta see a dentist. I'm like, I know, but I don't have the coverage. He's like, I can't help you. He gave me some like antibiotics, whatever, inflammatory thing. Didn't do much. I didn't realize I went to university. You also pay into an insurance there, right? So I was able to see a doctor. It still cost about $200,
Wow.
but it was only for a checkup,
Oh my.
right? So I would at least know what's happening with my teeth, right?
Yeah.
So I did the checkup, and she's like, "Yo," like she sees it, and she's like, "You got two options. Option A was going to be like $3,000." And then option B was like $1,000, right? She's like, option A is so much better. And I'm like, wow, that's amazing. You know what? I'm gonna think about that. I went straight to the pharmacy. I bought like 2 liters of mouthwash. And like every 2 to 3 hours, I was just mouthwashing.
Just home remedy,
And praying, and just praying.
Yeah.
And it went away. Like, that's right. But like, if I was in Korea, that would have been like, what do you want to do? How you want to handle it? We could do anything you want to do.
Yeah. Yeah.
Right?
And
So-
also, like, I don't know, maybe I could ask you, when you went though, did they tell you that at the receptionist or did they tell you that at the end?
The doctor told me that.
So you already went through the receptionist, went to the doctor.
And I went
It's
to the
already
doctor,
too late.
and the doctor was like, no, she gave me the choice of what you want to do, because I was just went for a checkup.
But then you still have to pay $200 for that.
No, that was a checkup. No matter what, I had to pay for
Okay.
that. But I at least wanted to know what it was.
Okay.
Like get a step closer to the end. You know what I mean?
Okay.
Right.
So here, if you come to Korea, if you're a foreigner without any valid ID number, they will tell you that you'll have to pay a certain amount of money.
Still
it's
that
still
much.
cheap. It's still like $50.
Right.
It's a lot cheaper than maybe America and Canada, but still they'll let you know in advance so you don't get ripped off.
Okay.
Yeah.
So let's jump into B, cost-effective treatment. I think we already jumped into that, but let's
Yeah.
quickly just talk about it. When you see a doctor, when I see a doctor just for normal stuff, usually I don't pay over $15. That's usually how it is. And if I have to do like anything else, I have zero anxiety going to the hospital.
Yeah.
Like zero. I know I'm not gonna spend over $20-30.
I had zero anxiety until I had my MRI taken. That's when I thought, I'm like, you know, these machines are expensive.
Right.
They're expensive to buy for the hospital, but expensive for patients to use.
Right.
So that's when I was worried because I had what many other expats don't have, extra insurance on top of national
We'll
health
get to that
insurance.
one,
We'll
right.
get to that later, but that I didn't know if that covered this MRI thing. But even that aside, so I'll tell you the price right now without the extra health insurance.
Okay.
The total came out to be $1,200.
For MRI.
For MRI, being hospitalized for 3 days, getting full 3 meals a day from the hospital,
wow.
getting 24-hour nurse
Treatment?
coverage, treatment for whatever help I needed, bell service. The bed was, I don't know, it was like 4-bed,
right.
patient
You
room.
share a room,
but
right.
but the bed was like, it was one of those like, you know, that
Machine lifts you up.
yeah,
right.
the machine lifts you up, and the leg too, it raises you up as well. And you get vitamin IV injection all throughout the days and stuff, and on top of any other thing. any other treatment that you need. The whole thing came out to be $1,200
Without insurance.
without just for the national health insurance.
I see.
So maybe without national health insurance, it might be higher, but because the government is paying for you that much, you get some coverage to $1,200. But I'll tell you the price that I ended up paying with the extra insurance in just a bit.
Okay, all right. And you know, like those MRI machines, I thought those were only for like star basketball players and football players when they get injured. Like I didn't even know those exist for like regular people.
It's because it's expensive to
It's
use.
super expensive.
And because the teams, the teams
They have their own,
cooperations
right?
with other,
Right.
hospitals, and they get discounts and stuff. So that's why only athletes will get it.
Right.
But these days, we talk about the change in the industry. A lot of people used to do manual labor, lifting heavy things.
Right.
Lifting heavy things are actually good for your health because you're actually working out and using your back muscles and your legs, right? But nowadays, people just sit in front of computers all day. We have that forward neck posture, which I even have. We're just sitting in front of the computers, working all day, not stretching enough, bad posture. It all leads to backaches, lumbar pains, lumbar strains, all that stuff. So then we, living in the 21st century, are more prone to these type of muscle pains and lumbar pains and the disc injuries.
Right.
And so I think a lot of the regular people nowadays also go through CT scans, X-ray scans, and MRI scans, including myself. And so but because Korea kind of knew that, the medical industry knew that, they put in a lot of these MRI machines and the CT machines and X-ray machines all over clinics and hospitals in South Korea. So it's really easy to find hospitals with these machines. So that's why when we talk about coverage, when we talk about accessibility, it's easy to find hospitals with these machines.
Right.
So that's why you never have to wait more than a week to set up an appointment for these. Whereas I heard in like different countries in Europe and in America.
In Canada, you're waiting months.
Right.
You're waiting months.
Exactly. I heard recently a story from this Aussie lady. Her husband had to wait literally like 6 months.
Yeah. Right.
And so you might as well just like remedy it at home. Like remedy exercise you find on YouTube to get better by the time you get an MRI scan.
Right.
But here, you might as well just take a trip to here, $2,000 airplane ticket, whatever. Still save a lot more money by doing an MRI scan within a week.
Right. All right.
Let's do number 3, speed and efficiency.
Okay. So bypassing the hassle of appointments and long waits. In South Korea, you don't need an appointment to see a doctor. You just walk in and get treated.
That's right. I mean, we talked about this earlier as well in the beginning, but to book an appointment, we have to walk in clinics in Canada, and these walk-in clinics will have you wait an hour or 2 hours, right?
Normally, when I was growing up, if you want to see a doctor, like if you got sick on a Monday, you would call on a Monday afternoon and say, hey, sick, whatever. Maybe you can get squeezed in on Wednesday. And if your appointment is like at 1 o'clock, can't be late. But if you get there at 1 o'clock, you might see the doctor at 2:30, if you're lucky. You know what I mean?
Yeah.
And then if it's just a normal whatever, you're fine. But if you have to see a specialist, you're waiting weeks or months. My brother last summer went in July, needed to see a specialist, and they said the earliest appointment is in November.
Right.
So that's July, August, September, October, November. That's 5 months later. This is why in Canada it's a big problem now that people are actually passing away from preventable illnesses.
Diseases, sure.
Right? Because you're waiting so long to get treated. Where in Korea, they're opposite. They're all about preventative measures here.
Yeah.
Right? People get health checkups all the time.
Yeah.
And Koreans are kind of obsessed with their health. And that's why I love it here, because they try to take care of their problem before it actually gets worse.
Right. So all these things come into play. So we're talking about the consumer's point of view.
Sure.
So this is great for the consumer's point of view. But for the nurses and the doctors here, they're working their butt off. 24 hours, for 7 days a week. They must be really exhausted and really tiring. So I really appreciate the doctors and nurses here. And so a lot of my friends who are nurses and doctors here, they do want to work in America or in Canada because the work-life balance is so much better there.
I think it's better in America. I don't know about Canada. I know a lot of people want to go to America. Canadians Canada was losing nurses to America.
Because they don't get paid as much.
And it was ridiculous. It was, right.
Yeah, America, they all want to work in America.
So I walked in, I did a normal checkup for my job.
Yeah.
And they like, hey, something's a little bit off, just come back. I came back, and then I wasn't feeling too well, and I spoke to the doctor.
Yeah.
And she's like, you know what, be honest, go to this hospital. They're bigger, they're better. I went there same day, and she's like, well, you need like some procedure, right? Simple procedure, right? And she was like apologizing. I'm like, why? She's like, you can't do it today. It's tomorrow, okay? And I'm like, you serious? Like 4 hours? Like, there's no problem. I can wait 24 hours, right? And that's how it is here. Like as soon as the doctor is available for you, as soon the next available appointment, which is usually that day or the next day, they put you in right away.
For sure.
Right.
One more quick story. My dad, he actually came to Korea not too long ago, and he's still here, but he got his physical examinations done in Korea when he still can have it in America with full medical coverage from the company that he works with. The reason why he got it here in Korea is because you can get all your tests done, all the blood analysis done, everything done in 1 day in less than 6 hours. So you schedule an appointment with a doctor to get physical examination. You could do it on the day of if they're not too busy, but usually like 3 to 4 days because there's a lot of appointments, right? And these hospitals are specialized for physical examinations. So he went in and he got it done. I think the total came out to be like $600.
Crazy. You do all that work.
All that and for $600. It could have been cheaper.
Right.
They also have seasonal events.
Yeah, they had like promotions for like hospital stuff.
Yeah.
Right.
If you go during events, 40% off. I asked the hospital recently. I won't say which hospital, but it's 40. It's a big hospital. 40% off. So that's like, I don't know. You do the math.
Right.
Yeah, it's a lot cheaper, right? But my dad got it for $600. Like 120 items of checkups.
Crazy.
A lot of stuff.
Right.
You can do colonoscopy as well. Different ways of colonoscopy. I haven't done it yet, but it's cheap.
You gotta do it.
Yeah, you gotta do it. So you've done it soon, right? You've done it recently.
That was the one I had to do, man. It wasn't not fun. It was not, but they take good care of you.
Yeah.
But it wasn't fun.
Exactly. And you get to see all the results too. So
They told you everything.
Transparent, right?
Right.